Welcome to the Stroke Academy. Serendipity is looking in a haystack for a needle and instead discovering the farmer's daughter. I am Dr. Gigi Kurutukulam, interventional neurologist. Many discoveries and inventions in clinical medicine has been serendipitous. Stentriver is no exception. Solitaire AB, which is probably the forefather of Stentrivers currently used, was originally designed as an aneurysm bridging device, so-called Solitaire AB. It was used as a device to bridge the neck of the aneurysm, and if it's not required, it can be taken out at the end of the procedure, or if required, it can be detached electrolytically. So that was the original concept, and serendipitously, one of the interventionalists during a procedure found that the patient has developed a thrombus in the M1. So he used the same device to try to pulling the clot out and found that it is extremely useful, and that is how serendipitously a device which was originally designed for aneurysm coiling found its place in the treatment of acute stroke. Thus came Solitaire FR. FR means flow restoration. So a detachable Stentriver which was originally designed, it was modified as a non-detachable device so that it can be used in the treatment of acute ischemic stroke for thrombectomy. So this is how a Stentriver looks like. This is a stent which is attached to a wire, so it can be pulled out. It is non-detachable. The tip, there are radio opaque distal tip markers which makes it visible under fluoroscopy. Some of the Stentrivers have stent body markers also, so that you can exactly know how much the stent has opened up. There is a proximal marker also showing the point where it is attached to the wire. Now it has got a parametric design, some of the companies, so it overlaps with each other. So if its vessel is more, it will overlap each other. If the vessel is big, it will open up. It's a self-expanding stent. It has got a working length and a non-working length. There are different lengths available. This is a 40 millimeter stent, and this is how it works. The clot is there in the middle cerebral artery M1. Under fluoroscopy, identify the thrombus, and a small micro wire is passed very carefully through the clot distally. Once it is parked in one of the branches of the middle cerebral artery, a micro catheter is threaded across that, and after removing the micro wire, under fluoroscopy, the Stentriver is taken through the microcatheter. You can see the markers under fluoroscopy, and once it is positioned optimally, you can see how it should be positioned. And then the microcatheter is slowly withdrawn, pushing the Stentriver out so that it engages the thrombus well. It is left there for some time. See the central part which is engaging the thrombus, it slowly opens up and catches the clot. And after inflating the balloon guide catheter, the clot is very slowly, carefully pulled out. Once the Stentriver is pulled out with the clot, the flow is restored. There are many Stentrivers in the market: Solitaire FR, Trivo, Revive, Epirio, Catch, Preset, and the recent one, Embo Trap. Each company claims that theirs is the best and superior. Each has got its own advantages and disadvantages. Now, what are essentially for Stentrivers? What are the advantages? One, it goes through a microcatheter, so it is easy to reach the clot even in M1, even in a tortuous anatomy. With a micro wire, you can cross the clot and take the microcatheter across the clot. So even if the anatomy is bad, you can reach the clot easily and deploy the Stentriver across the clot. The second advantage is, the moment you deploy the Stentriver, it establishes blood flow. So that is called a temporary bypass. So the moment you deploy the Stentriver, flow is restored and the brain starts breathing, getting oxygen and blood. If you're using a balloon guide catheter and if properly deployed, the chance of distal embolism and embolism new territory is less. But disadvantages being it's costlier than an aspiration catheter. In India, it costs around 1.8 to 2 lakhs. Repeatedly used, there is always a minor risk of the stent getting detached. Vessel perforation is always there. You have to be careful, especially when it is deployed into a very, very distal branch. So that's for today about Stentrivers. Thank you. See you tomorrow.